Disparities in Healthcare. My name is Jofol Edmonds for Compton Culture class. My stance on this matter, I believe that there are socioeconomic disparities towards employers, employees, and customers in healthcare. I also do not believe that there are any sort of monumental changes that are occurring in healthcare to rectify this. One, social, racial, financial class, and society, and even gender play a factor in how they are treated in healthcare in the healthcare department. In this essay, I will be proving that there hasn't been any monumental changes and advancements in the issue of prejudice and discrimination. Healthcare has become a basic need in today's day and age. Everyone needs healthcare. Um, with the advancement of medicine and new diseases mutating and viruses, as we can see in the COVID pandemic, healthcare is very important and it is necessary to life nowadays. And good healthcare can be the matter of life or death for a lot of people, for majority of human beings on this earth. So healthcare is very important. And today I'll be targeting how prejudice in healthcare affects millions of people, but just using very small researches that were done. The first research I would like to talk about study took place in rural Ghana. It was conducted by Ageman Dua Williams. The target group for this research was specifically old poor people residing in rural areas of Ghana. There's a LEAP program. The LEAP program is kind of like a financial aid for older people who don't have a lot of money in lower income families and homes. The grant received bi-monthly by these people were between $13.42 American to $22.23 American. Older people enrolled in LEAP programs spent between $10.48 to $20.96. That's what they normally spend to a doctor's visit. Now, that's really not enough because that's just the average. A lot of times you go over, and everyone knows that medical expenses are very expensive, especially this is a third world country. And as you can see there, by their currency, it's not that much. It is $100 to $20 American. So you can already see that it's not that much money. So with that being said, that kind of money will not suffice because that's just like a regular visit. What if someone needs an X-ray, an ultrasound, a CT scan? You know, these things will affect the balance, the medical bill. So these things are I don't think they're taken into account. It's just an average, but with just an average of $2 and some change, that is not enough. I think they deserve way much more because a lot of times things happen out of the blue and then you need that money. Now, the NHIS is a pro-poor policy group and they help poor older people in vulnerable populations, especially older people, and they help them with healthcare services and reduce their healthcare costs. Now, in living in rural Ghana, they don't have a lot of healthcare facilities around them, so they have to travel very far to get these, to get the service they need. And even if they have the money to go there, how can you get there how can you get the proper healthcare you need without going to it? And a lot of times they go miles and miles away. It's not like us in America who have the privilege to go a couple miles. There's 2 hospitals, 3 hospitals we can go to with each specialization. It's just a general hospital for these people. So that is one of the ways. And I think, well, you can see by their finances that they're kind of being neglected by the government because they're older people who don't really contribute financially as much as society, so they're neglected. And the healthcare wise, that if they were bringing about a sumptuous amount of money into the economy, the government would see this and they would use that as a factor to help these people. But because they're not, they're kind of neglected. And that's just one of the reasons where there's a disparity, socioeconomic disparity in healthcare. And we can see that with the more wealthier you go in Ghana, the more resources, facilities you have, especially healthcare. You have better doctors who are more trained. Some of them are even international. Second point I'd like to make is from Manisha Dutta. And she attacks the idea of socioeconomic disparities in the healthcare system. The study surrounds a good quality healthcare surrounded by financial age, and social status disparities in the healthcare system. Um, the healthcare system, well, in this study, it shows that even though people have this, they're neglected because of their race, gender, and age, and they don't have the facilities that are needed to take care of these. And to die to divert from this actual research, we can look at it from today's day and age. 2 years ago, when coronavirus pandemic really struck the world, Black Americans, low-income Black Americans, were neglected by their government for a very long time. They didn't get the proper healthcare services, the proper treatment. They didn't get even the vaccines in their neighborhoods until the more higher income neighborhoods had received. Sometimes it was on the news that people would leave the lower income neighborhoods to go to high income neighborhoods just to get the vaccine to make themselves safe. So that's just one of just today's day and age, how things have not really changed. This study, it's recent, but as recent as 2020, 2019, and we still see this plaguing our society. And that's just one of the ways that prejudice is still affecting the healthcare service. And the next one, literacy mediates racial differences in financial healthcare decision making in older adults. So literacy, there was a study done, and it kind of made a correlation between literacy, financial, and healthcare making decisions. It shows that there is a very high correlation between literacy, financial, and healthcare decisions. Through the study done, it shows that when literacy is balanced, financial and healthcare decisions are almost, there's no big difference between them. They're almost insignificant. The difference is almost insignificant because literacy plays a factor. Um, it creates an abnormality where you have these people, because of their race, and because they were put at a lower standard in the literacy field, it makes them make poor healthcare decisions, poor financial decisions, and it's just all the full circle. And this research tackles this, and it shows that racial differences in decision making and healthcare making is largely mediated by literacy. So if we help literacy, it shows that healthcare decisions will go up. So people start eating better, drinking more water, eating less fast food, eating more organic stuff. But because they don't do this, because of the literacy standing, they don't have the access to these resources. And the government, the government is kind of, they have a power in literacy because literacy is started from schools, and schools are funded by property taxes, income taxes. So if you build a certain area up, housing prices go up. That means the education system gets more funding. But in lower income neighborhoods, you don't have this. So you have boys, girls, men, women, old people, whatever. They're making these bad financial and healthcare decisions. And then that also leads back to the prejudice in the healthcare system. So this research just goes on about, it just talks about how healthcare decision making is affected through literacy, and how when you reverse literacy, people make better healthcare decisions. And then with that, there will be less prejudice. The last one is racial disparity in healthcare utilization among patients with irritable bowel syndrome by Casey Silverman. So this research it kind of contradicts my actual thesis, but to some degree. So, for example, Black and Asian patients, women, were given higher gastroenterology procedures than their white patients. Now, you can look at it both ways. You can look at two ways. Either that it's contradicting my thesis because the minority groups are actually getting better, more care, or it could be that they're in their efforts to do that, they're neglecting their white counterparts, because the research says it is a significant difference between Asian, Black, and their white counterparts in these procedures. So both Black and Asian, and I quote here, both Black and Asian IBS patients were more likely to have an IBS-related primary care visit than white IBS controls. All these three minority IBS cohorts received significantly more gastroenterology procedures compared to the white IBS controls. This also leads back to my previous point about literacy and how it affects healthcare decision making. Because if you get the literacy standpoint, well, just towards the African American community in America right now, literacy standing for African Americans is rather low compared to the other races, and that trickles down into their healthcare decision making. So with that being said, now they have a higher prevalence to contracting these diseases, these viruses, these infections, and then they have to go into these healthcare services seeking medical attention, then faced with prejudice, discrimination, and it's just a never-ending cycle of just you waiting, you getting disrespected. Some might give treatment. A lot of it also depends on their socioeconomic standpoint, because you have African American people out there who are there, as the literacy goes up, you see these discriminations start to go down. As you and that was stated in my previous slide in the research, said that when literacy is mitigated and it's at one point, the difference in financial and healthcare decisions are so small, it's almost insignificant. So it goes to show that once you control these things and help, and people start doing making good choices financially, literate, and in their literacy, healthcare decisions start to become better. But that can't start without some type of change being made, because as we all know, throughout history, certain group of people have been put at a disadvantage over others. So yes, that's my video. Thank you.